what levels of total and free testosterone do you average see when patients feel good?
Oh, that's a good question. I would ballpark a free testosterone for most of my patients somewhere in the ballpark of no less than 20 nanograms per deciliter, probably closer to 40, 45 nanograms per deciliter. So I tend to have a pretty broad range there. I have found that, I frankly think a lot of men are significantly underdosed. I know Keith Nichols has, I think, been on here before and spoken to that well, and I think he's well versed in that topic. I do find that a lot of people have a confusion when it comes to hormone replacement therapy. And I don't know if, the best way to put it, but essentially don't confuse endogenous or internal hormone production and processing with hormone replacement therapy. It's not a one-to-one at all. And when you start playing that game, you can end up in a bad position for your patients. So I do tend to push the testosterone levels a little bit higher. And I find that a lot of my patients do feel best in that slightly higher range. So just a total, for example, would be it's probably something closer to the ballpark of 900 nanograms per deciliter. And with the creams, gosh, it's hard to keep it under 14 or 1500 sometimes. They are really, really potent at pushing those levels up.
Yeah, sure thing. I regularly see for myself 1200, 1300 nanograms per deciliter, which is still normal and fine. But still on our lab ranges here in Europe are a maximum of 900, 950 nanograms per deciliter. So they brought down all these lab ranges. That's probably because of an unhealthy population.
Yes, I couldn't agree more.
Yeah. And what would be the reason that our general population is lower in testosterone than generations before? Maybe I think it's a good moment to start talking about EDCs.
Yeah, I love that. I love this question. Endocrine disrupting chemicals is what you're referring to, Stephen, and it's fascinating. And I think we're really, frankly, just starting to learn more about this. So we have our endocrine disrupting chemicals, which are probably the most prevalent and the most potent. And so literally, if you guys can think about it, these chemicals look, act, and behave very similarly to estrogenic hormones. And so most plastics are probably the most popular thing where this would be coming from. And in this day and age, it's almost impossible to avoid them. I mean, actually, I would say it is literally impossible to avoid them. There are, plastics in our clothing. There are plastics in our foods. There are plastics, in and around us all the time. And that's not to be pessimistic, but what we're ending up with is a really dire position where we've lost. And Stephen, I don't know what it is in Europe necessarily, but I think in the United States, we're down about 50 to 60% in total testosterone since I think the 60s and 70s, which is massive, absolutely insane in a very, very, very short period of time. And of course, coinciding with, lower sperm counts, on the female side, this is just as big of a problem where they're entering into menstruation earlier. They're suffering from more PCOS and endometriosis. Of course, we're seeing male prostate cancer constantly on the rise. So I have been a big advocate of, okay, we're in a dire position right now. I don't think we have to be ashamed about that or hide from that fact. But more importantly, I also think this is to some degree in relationship to our mental and physical health deterioration. And so in my opinion, if there are at least obvious enough factors like endocrine disrupting chemicals that are pervasive in every single part of the world at this point, we're seeing these declining levels in hormones. We've measured them. We can speak to them. I don't understand why we wouldn't start with something like testosterone replacement therapy over an SSRI, for example, which again, in the research, we're seeing SSRIs as being essentially like we don't understand why we're giving them. And whereas with testosterone, we have a very, very clear understanding of it, much clearer. And at the very least, God forbid the guy's still sad, at least he's stronger and less fat, and maybe his wiener works a little bit better. So I'm a big fan of looking at that. And same for the females. I think that there's a huge disparaging issue with female patients and on that same level. And some of the endocrine disrupting chemicals, again, even so far as some of them affecting our cortisol too, where we're seeing more cortisol on the rise, which is more catabolic. So it's stripping muscle tissue. It's stripping away our immune system in a lot of ways. It's just a really bad place to be. And I think it's annoying that hormones aren't at the forefront in a lot of ways just yet. And I think we're changing that.
Yeah. And what do you recommend patients to do to protect themselves from EDCs? Or is just getting on hormone replacement immediately a protection already?
Yeah, that's a fantastic question. I think both, really. I do think both. And I know that sounds probably a little bit premature in some ways to some people, but I think the silliest thing to do is start hormones at the very latest point. I think that was the old school mentality, which was, we wait till a male or female's, bones start to deteriorate and their muscle tissue goes to shit and their brain health is gone. And then we can start them on just a little bit of some sort of synthetic hormone that's going to kill them earlier anyways. Versus, why don't we start at the earliest point we can, frankly. If it's necessary and if it's needed, I think it should be initiated. The more we can preserve muscle mass, the more we can preserve your bones, the more we can preserve your brain and your heart health. It puts less burden on the system at large. It puts less burden on your, kind of microsystem at home. I think that's fantastic. As far as the endocrine disrupting chemical side of things go, I think it's extremely important to just be mindful and at least aware. There's no sense in driving yourself crazy trying to avoid it because we can't. But don't microwave your food in plastic Tupperware. Try not to wear plastic clothing all day long, especially if you don't have to. Attempt to get outside and get some sunlight. All the basic tenets, right? Just try to be mindful. Try not to drive yourself crazy and do your part there. But again, I'm an optimistic guy. I do actually see, at least in the United States, we've had some really interesting changes going on over the last few months. And hopefully we'll start seeing from more of a top-down approach, a really big shift.
Yeah, let's certainly hope so. Do you also see a problem with the eating of soy and all kinds of nutrition?
Yeah, I do. I think, soy products at this point are almost like wheat products. Meaning, I think probably there was a point in time where soy wasn't so unbelievably detrimental. And maybe similar to wheat, and at least, especially what we've done to it in the United States is just bastardized these poor products to the nth degree with genetic engineering and things of that nature. We've created a Frankenstein product, and I'm somewhat curious if that is also just potentiating some of the estrogenic effects of something like soy, for example. So again, I'm not disparaging people from eating soy at all, but or entertaining that, but it is something that I would not make a huge part of my diet. I agree with also like some of the processed oils. At least in my opinion, it seems very obvious that eating too much of them is probably somewhat detrimental to your overall health. So yeah, I hope that answers your question, Stephen.
Yeah, even in my practice, I see a lot of moms with their little kids, sons often, and they switched completely from dairy to soy products because of so-called allergy or whatever. So a lot of young boys are on soy instead of milk. I think that's frightening for the future, right?
I couldn't agree more. And it's funny you mentioned that. A lot of people have said, Nico, what are the natural things I can do? And I always try to remind people too, sometimes just because something's natural also doesn't mean it's safe. So, I've spoken to a lot of my patients are very health conscious and that's wonderful. And they like some of the holistic and alternative remedies. But for example, I think this being in your world of skincare, tea tree oil, lavender oil, these essential oils are highly, highly, highly estrogenic compounds. Again, sparingly, totally fine. And they have some amazing benefits, but used daily and frequently, it can create some really, I actually had a male patient with gynecomastia and I'm quite certain it was because he used an incredible amount of tea tree oil for acne, like an unbelievable, really unsafe amount of tea tree oil.